Tell us all about Luminoa.
Yeah, so Luminoah started in 2020 and came out of a very personal need to change the standard of care for tube feeding, and it really started with my son Noah, who when he was 3 just started choking on his saliva and his food, and we did a scan at UVA Children's, and we got the news that no parent wants to hear, which is that he had a rare brain tumor. And so our world was completely turned upside down. And he'd go and get chemo at UVA Children's and come home, and all he wants to do is play with his twin sister. But instead, he was being fed by a decades old enteral nutrition pump, which is a gravity-based system. Requires a bag that you replace every 24 hours. You connect 6 feet of tubing. You can see that tubing got caught up on his IV pole, and it pulled out his gastrostomy button. He was excruciating pain, and you were handwriting logs when he last got a feed, because there's no data tracking with the technology. And we later learned that our story wasn't unique. At enteral therapy is needed for over 1 million people in the United States, primarily driven by people with cancer, GI disorders, neurological disorders, but of all ages, from beginning to end of life. And because data today is disconnected, providers have they're really blind to what's happening both in the ICU and in the home. And it's important that if someone's trending to being malnourished, this leads to malnourishment, not having the insights. But if someone is trending to being malnourished, a patient has a 5x increase in mortality. The health system loses on average $17,000 per readmission. Malnutrition is actually now the fastest growing cause of death in the United States. And it contributes, not the full amount, but contributes to the $58 billion excess cost to the health system in the U.S. So enteral nutrition space is a large market, just has not seen any real innovation in several decades. The U.S. market's $4 billion. That includes the formula that goes into the pump and the bag. The pump and the sets are about 1.5 to 2 billion of that. Global market 12 billion. About 4 to 5 billion of that are the pumps and the sets. And how we solved this was creating Luminoa Flow. It's the first closed loop personalized nutrition platform. And so, as we developed Luminoa early on, it's very similar to what you probably have seen in diabetes care. The artificial pancreas algorithm came out of UVA, and our COO integrated that algorithm into the first insulin pump, the T-Slim at Tandem. And so, if you know where diabetes went from prick test to a phone controlled pump with a CGM, it's where we're heading with enteral therapy. So we built a smart pump, a daily admin set, and a full data ecosystem that we're building full pump control around. So we'll start with the pump. So the pump is, it's very small and easy to use. You can see the size is smaller than my iPhone from a footprint perspective. It's can pump against gravity, so that's what we had to solve from a technical standpoint. And so we can pump something as viscous as water to something as viscous as applesauce through the system. And then we built a daily admin set that, instead of having this big six foot of tubing singular kind of hospital bag that's on the pumps a day, it's more like a go-go squeeze, right? That you would see with applesauce. This disconnects 2 feet of tubing, and the way this is worn is through a what we call a magnetic belt clip. You can see how that attaches there. You can put the pump right on your waist or that fanny pack, and then the set with the nutrition goes right into your pocket. This connects here, and then you would connect this to your gastrostomy button or into an NG tube in the acute care setting. Um, and what's great about this is, like Noah, our son, had to be homeschooled, and now, someone like him can go to school, get a feed, no one knows, or an aging parent with dementia or stroke can, uh, you know, not be tethered and fed at the bedside and be more mobile. And so the technology itself and the form factor will completely change the way people live from a quality of life standpoint. And it's the first connected pump. So we've got a mobile app that all the data flows into. Um, this will be the first time in human history that you can see in real time, how many calories have been delivered, how much hydration, what are week over week, weight changes. So this is what the app looks like, and all that data flows into a provider portal called Luminoa Intelligence. So if you have, a health system, you have 5,000 people on this pump. Uh, you see a dashboard with the status of every patient. Are they turning into being malnourished? If so, intervene before that patient has that costly and deadly situation. And then over time, as we build larger data sets, we'll personalize nutrition to make sure that patients are getting the right nutrients for their disease state and drug therapy. And so we got FDA cleared a couple weeks ago, and now we're kicking off a early access program. We've got built-in reimbursement with current B codes. So the pump on CMS national reimbursement's about $1,200 a year. The sets are about $10 a day. You need 365 sets a year. They're daily use. And then we're introducing RPM into the clinical setting. So it's about $1,500 a year on reimbursement that will enable health systems to get. And so our early access is kicking off here in a few weeks, starting with UVA Health, then Providence and Orlando Health. Then we'll move over to Texas Children's and Children's Hospital Philadelphia. We've got about now, I think, 45 health systems that want to partner with us as we grow and scale. We intend on selling about, we say sell, but really impacting the lives of about 1,000 people this year, about close to 10,000 people next year. I think this model has about 6,000 active pumps in next year. But we're raising a 20 million Series B that we intend to close here in the next, month or two. And the goal of that Series B is to build out a commercial team, build up automation, and work towards break even, which happens in 2028. This is a pretty conservative base case on the model. I think we've got a real opportunity to certainly overshoot these numbers. But looking outwards, a 2020 31 certainly have the opportunity to be a multi-billion-dollar valued company. And so my background, I spent most of my career at Pfizer. I was with Pfizer for 10 years as a president of a group before I left. Did a lot of product launches and then went into emerging markets. I worked in about 18 countries across Africa and Asia with different technologies. Garrett, came from the diabetes care space and really transformed that space. Brian Hansen's the president of Senseonics. He's our independent director. The best news for us is Noah's now 9 years old and cancer free. So now we just get to go and help a lot of people. And, that's why we wake up every single day is to achieve that mission. So, yes, really, really great to be able to share this with you all.
Neal, I love it so much. It's so smart, and there's so many facets here that it kind of blow my mind in the sense of this feels like an entrepreneurial case study that's just absolutely textbook. You're in that situation where you see that something that you can make a change, you can do something to fix something that talk to me about that moment. You mentioned how Noah had like the feeding line. He tripped on it and it pulled out. Talk to me through that kind of moment. Like what was going through your mind, as that was happening?
Yeah, at the time, I'm just a dad trying to survive through this moment. My wife and I both were CEOs of different companies at the time, and now suddenly we're caregivers, and we just are doing our best to keep everything together. And it was really hard going day to day, getting chemo, not knowing the outcome. And I think in life, when things are out of control, you try to control what you can, and that gives you a sense of peace and that you can make a difference. And I'll just never forget, coming home with Enteral pump, and we're giving medicines through the pump. We're flushing out a PIC line where before you had a port, and just how scary that was for us. And seeing Noah day to day pushing around an IV pole, and stepping on the tubing and that coming out. I mean, he was just in excruciating pain, um, and I couldn't control the outcome of whether or not he was gonna respond to treatment. But what we could control is how people experience enteral therapy. I was not seeking to start a startup. I'd never started a medical device company, and it was truly out of necessity. And so I remember um, late 2019 starting to draw out a few concepts, and had no idea what I was doing. It's like, let's just say you weren't an architect and you wanted to build a house and you draw out a piece of paper what a house would look like. I mean, it was pretty basic, and started drawing this out, but I just couldn't quit thinking about it. And yeah, we all have passing ideas that come and go, and sometimes we act on it, and but most of the time it just passes. But I just couldn't quit thinking about it. I was really lucky coming from Pfizer, where I could get up to speed on a new clinical state. And while Noah was getting chemo, I had nothing else to do. He was, and they would give him Benadryl. He'd sleep during that time, so I could just sit there and worry, or just start researching, talking to other clinicians and patients there, and who are going through similar things. And through that, just started focusing on that. And I was running a family office startup at the time, and so I had access to capital, and then a really amazing ecosystem here with Sivo BioHub, who supports early stage startups. I was able to find regulatory support, was able to find a general counsel, IP lawyer. Being next to University of Virginia, they have a really good master's in BME program, so we were able to bring in three students. This is now March of 2020 when we started, and the pandemic hit. They had all lost their internships at Medtronic and other places, so it was an opportunity to bring in really smart engineers to see a research project. And during that state, March of 2020 is when we created the company. We needed a name that really became our North Star, and we wanted Noah's name in it to bring back a why we're doing this. And then when you ring the bell at UVA Children's Hospital, there's a painting of a rocket ship, and we talked a lot about space, so we merged illumination to measure light between stars and Noah's name to create a brighter future for tube feeding. And then once you do that and register the domain, you can't stop. You can't look back, right? You got to go. So we were committed at that point, and so it was a research project for that first year, and then raised capital. And here 6 years later, lot of ups and downs on that journey, right, of getting here. But now we're cleared, and we can actually achieve the mission of helping people.
And I,
That's
I, I,
incredible.
I love it so much. It's like you're watching like dad mode activated and entrepreneur mode activated at the same time, and they're both working in sync. And I think it's inspirational. I think it's absolutely huge. I think back to watching my wife, 5 years of IVF, trying to bring my son into the world, and the powerless feeling, as a guy, what can I do? How can I help? How can I be
Yeah.
useful here? And getting to that place you mentioned of the control aspect of, I need to do something. I need to do something that makes me feel like I'm being as useful as I can be here. And we were, me and Jillian, speaking to a good friend last week who got the all clear from a cancer diagnosis in March, and was saying, at the point where he thought he wasn't going to make it, he just started fixing up the house. He's like, I don't want to leave my wife with a house that needs to be fixed up, so I'm just going to get busy. So I think it speaks to so many people, that notion of, I'm going to get busy, I'm going to do something. I would love to learn more about the the technology here, because I want people to really understand the huge shift from what was to what is now because of the Luminoa Flow. Can you talk to us a little bit about that jump?
So, in terms of how we move from the current state of care to
Yeah,
um, move into this new state of care.
Such a
Yeah,
big
so for
innovation,
us,
Jack.
it starts with you know, early access. So getting, leading uh, institutions using the technology and then expanding, publishing data. So we have, me coming from a pharma background at Pfizer. It's really important that we're contributing to the body of evidence in nutrition, clinical nutrition therapy. There's very limited data here today, and we want to contribute to that. With real world evidence, having a data ecosystem, we can really publish around real world evidence on different disease states and understanding how to better personalize nutrition for different disease states to optimize therapy, and the ultimate goal is to improve outcomes and potentially shorten the duration of disease. We you always hear food is medicine, and what if in a state now that we know down from the macro to micronutrient exactly what's being fed to someone, and a disease state and drug therapy, and we can have that controlled state and measure outcomes, and so as you mentioned, we're going into a broken healthcare system, right? It's very fragmented. There's a lot of players, and we sell into the acute care channel and to the home care channel, and so for us, it's really important that we find the right partners that are mission aligned. Like we wake up every day not to bring a technology to market for the sake of bringing a technology to market. We've talked to over 1,000 people over the past 6 years to give us inputs, from the payers to healthcare leaders to clinicians to people of all ages on enteral therapy. And so we wake up every single day to improve the lives of people, and to solve the problems that are associated with clinical nutrition in the health system today. So we're very selective of who we partner with, that make sure they're mission aligned with us. And then we've got a clinical team that we're putting together with KOLs to help shape kind of the nutrition reporting process that we're developing, and how that standard will shape. We're part of a lot of industry associations, like the American Society of Parental Enteral Nutrition, American GI Association. We were just voted as one of the most innovative companies in GI. We did a big program with AGA and Matter where we presented Digestive Disease Week with CEO of the AGA and key opinion leaders. And so we want to really partner with those institutions to be part of the solution, right? And not because we want to sell pumps. Yeah, that's something you have to do. We're venture backed. Let's get the multiplier that everyone needs, right? But how do we truly shift the state of care today? And it just takes time, right? It doesn't happen overnight. But we've got a really robust plan and strategy, and we've got just great commercial leaders around this organization who are some of the best that came from diabetes care or clinical nutrition that are on this journey with us.
And I want to just I put in this stat up on the screen. This is one of those stats that just blew my socks off. That I just could not kind of get my head around. That notion that 1 in 5 cancer patients are dying from malnutrition. Um, I know you went through some of the stats in the presentation that you just shared, but do you have a real feel for how many people can be impacted by Luminoa Flow?
So, starting in the United States, there's about 1 million people that need enteral therapy. Here, about 50% are adults, the other 50% are kids. Um, there's 300 disease states, as mentioned. As you go globally, that number goes to 3+ million people. There's a similar amount of enteral pumps in the United States as there are insulin pumps. And so we intend to start in the United States, but we have plans to go abroad as well, going to Europe, Canada, Australia, other countries. And so this is just the beginning for us. It's a a large unmet need here in the U.S. and around the world, and we're starting with this foundational technology, but it's going to evolve. We've got a pretty robust pipeline of innovation around enteral therapy that will continue to release products in that pipeline here in the years to come.
That's
How are you
awesome.
how are you feeling right now? Like, are you excited? Are you nervous? Like, what's going on right now in Neal's head and heart?
Yeah, I think I'm always a hybrid of the two, right? Where you're excited and nervous. The excitement is there's a lot of momentum around the company right now. You get through a lot of ups and downs in the development cycle. Things sometimes take longer than expected. But what's really validating the excitement side is you were getting close to working towards closing on a Series B, so we can capitalize and actually build up enough product to meet the demand. We've every single week I'm in a different health system across the country, and some of these sites that don't allow companies to come in, and where there's just the amount of clinical excitement, enthusiasm with some of the leading health institutions in the country. Um, it gives me a lot of excitement, right? Where people want to, when we're there, they want to take a photo, let's with the pump, and like this is transformative for patients, and it's just very validating because you work so hard, and it's a personal mission, and you don't know how. I mean, you get feedback, so you have a feeling you'll know how the market responds, but until you're there, until you're cleared, you're negotiating through agreements. That's when things get hard for most companies. And for us, what we're seeing is people kind of trying to be in line first to be able to get the technology next. And so that is really exciting. What makes me nervous is just, this just you're just on the journey, right? Like how fast can you build up? There's so many problems you're solving, right? You're building up commercial organization, you're building up automation, manufacturing, you're building out, your HR and your organization. And for us, recruiting is so important in terms of the people that we bring in. Not only the investors, because we want partners that believe in the mission as we do, right? Clearly, all the numbers have to be there. Let's just assume that's there, right? We want the chart to look good when you're showing to an LP that we're the multiplier and the growth that you want to, yeah, that you'll raise more money from your LPs because we're growing. But you've got to be here for the right reasons, and that's the achieve the mission. And so we take hiring very seriously, and that every single person we hire has to be aligned with that. You need to pay well and be competitive, but that's not what should drive our employees. It's the people that we serve, and so everyone that we work with, so that's the kind of thing that like you're building a plane, getting it off the ground, and you're nervous because is it gonna what kind of bumps are you gonna hit as you're taking flight, and have you prepared enough? And you prepare the best that you can, and then you know that there's going to be things along the way that you miss, and you figure that out. And so I think when the short answer is, I think with every entrepreneur, there's excitement and nerves all there wrapped around at the same time. I mean, I'm probably going to be in tears in a couple weeks when the first kid is using this pump. I mean, we're going to have these big celebrations at each site and red carpet for the families, and big events that we hope to make people feel special versus just someone with a complex medical issue. And so now someone's going home with the technology, right? I'm not going to sleep as well. You know that the pump is good, it's ready, it's you'd put it on your own family member, and then now it's in the real world,
Yeah.
and so it's exciting and nerve wracking all at the same time.
Well, I really hope you take a minute to just appreciate what you've built and what you are continuing to build and the impact that it's going to have. Luminoa Flow is going to save lives. Like there's no two ways about it, right? The impact it's going to have, it's got the ability to come in there and save lives. I mean, I do have one, I guess, VC related question to ask, but before we even get to that, I know we're running out of time. How is Noah handling this? Like, how is he feeling right now? He must be bursting with pride for what his dad has gone and is building. How's Noah feeling about all of this?
Yeah, he's excited. It's we got F. So in December 5th was his 5-year anniversary of being cancer free, a big milestone, and we had a big celebration here in Charlotte. So we had about 150 people, people that are connected to the company, family, friends, and actually the artist that this rocket ship painting. This is a copy of the one that is at UVA Children. She created a copy of that for our office, and then uh, she came up and spoke. All Noah's care team was there, and so like for him to experience that was a big moment. And then the day we got FDA cleared, we were coming home from a little league baseball game with him, and um, we got into the driveway, and the leadership team called us 7 p.m. on a Monday, and so we just got the letter from the FDA, and a quick pause just to put some suspense, and said we're FDA cleared. I had the phone on speaker, so my wife and Noah and his twin sister were there, and everyone's in tears, right? It's like knowing how much has gone into this, and now this technology can help people. And then just yesterday I was at Texas Medical Center and Texas Children's, and one of the doctors who's a leading researcher in Noah's uh, type of cancer that he had, people come from around the world to Texas Medical Center, Texas Children's to get treatment. And I got to see that doctor and meet him for the first time. He was, working directly with our clinician at UVA, and I gave him a rocket ship painting. And like, you tell these stories enough to where you can tell your personal hardship and you're okay with it because you've got certain sound bites of that you bring up. But I walked into that room and I saw other kids that I know have the same rare cancer he has. I just lost it. I could barely talk. And when this doctor came out, I was teared up, and I'm like, I'm sorry, I didn't realize I was gonna have such an emotional response. And so I shared, Noah had wrote a letter for his class about his cancer journey, and in there he talked about how hard it was when his first chemo didn't work and the cancer spread, and how he had a second therapy that solved it. And it was because of this doctor and the doctor that we have at UVA that did that. So it was a full circle moment that I was able to share back when I got home, with them this morning before they went off to school. So it's all very interconnected, and we don't want Noah to be have to have his whole identity to be a kid that had cancer, but we really allow him to share when that's okay and not, and he's really leaned into it. And so they like volunteering at different things with kids with complex disease, and they're really proud to have that identity and now be able to use a story to inspire and help others.
That's amazing. I'm like, I need Steve's tissue box.
Oh God.
Yeah, that's incredible. And I think about that question. I ask myself that every day: who am I serving? Who needs me today? And I think that's clearly so much of what drives you and Luminoa as an organization. And I'm sure for Noah that is, probably key for him too. He knows who is being served through this. So it's amazing and incredible to hear that the story from yesterday that was just yesterday that you were there. Wow. Yeah.
Yeah. Well, Neil, I know we're at time, and I want to be conscious of that. But it's been absolutely amazing speaking to you and hearing your story over the last bit of time. You're an absolute inspiration as an entrepreneur and a dad. So to all the dads out there that are watching this, you hope and pray that they'll never find themselves in a situation where they've got to go through the journey that you went through. But you hope that if they do find themselves in that position, that they can find the strength and the courage to build, to do something, to do whatever they can to help in that situation. So thank you so much, Neil, for being here and speaking with us today.
Thank you, Steve. Thank you, Jillian. Thanks for having me.